I'm Sarah Wendell, Vice President of Clinical Strategies and Physical Therapist. I'm here at the Lieberman Center for Health and Rehabilitation today with Sigmund Koo, who's also a physical therapist. We're going to be talking about manual therapy. It's one of my favorite codes, and manual therapy is basically a collection of techniques that will allow us to improve pain, reduce edema, restore mobility, help with swelling, and really help with some of those mechanical things that are happening with movement. So Sigmund, can you talk about some of the manual therapy techniques that we can use?
Yeah, absolutely. Well, as the name implies, it's a very hands-on technique that we use. One of them is specifically called manual traction, where you can target parts of the spine, specifically cervical or lumbar, and you can pretty much separate the joint a little bit, cause a little bit of space to allow for better circulation, better fluid, more fluid to come into the joint space, and increase the mobility that way. And a lot of patients find a lot of pain relief with that technique as well. Another one that we do is joint mobilization and manipulation, where we use different grades of pressure, different varying speeds to target the joints themselves to help increase the mobility, the sliding, the gliding of the joints. This could be done on the spine and different joints like the glenohumeral joint or the knee itself, and something like just light pressure to a grade 5 manipulation where you want to get a cavitation. Another type of technique is called soft tissue mobilization and myofascial release. So this is very popular as well to help decrease pain, help muscle relaxation, and to take care of other mobility deficits. And what you do is you do a lot of sustained pressure on a specific point in the muscle while you guide the muscle through its range of motion. And that's also very popular and very helpful in decreasing pain and improving movement. Last one that we can talk about is called manual lymphatic drainage. For people who have conditions such as lymphedema, manual therapy is very helpful and useful in decreasing the edema, helping the flow of the fluid to go back into the systemic system, not just pool in the limbs and extremities.
Great. So something that's really important to note is we cannot bill manual therapy and therapeutic massage on the same day. So that therapeutic massage code is 97142. But if we're utilizing the more skilled techniques such as soft tissue mobilization, we can just do all of our manual techniques under the manual therapy code. So let's talk a little bit about documentation. So do you want to talk a little bit about how you document for manual therapy techniques?
Absolutely. So like all sorts of documentation. You want to say what you're doing, target the specific muscle, joint, whichever it is that you're aiming for, what kind of techniques you're using, whether it's traction, soft tissue mobilization. If it's joint mobilization, you want to document the specific grade of movement, pressure, and speed, and the duration, frequency, and intensity, such as other interventions that you might use. Some other things that you want to document is kind of before and after the treatment, if there's any immediate effect, such as on range of motion, pain, other objective measures, things like that. And of course, if you're going to check out a limited range of motion, you have to see what the end feel is, whether it's a boggy end feel, hard end feel, soft, and what your assessment is on that end feel, what might be causing it. And of course, at the very end, how the patient responds. If they feel better, if it feels worse, if it's something that you might not want to do in the future.
Excellent. So can you give me an example of a instance where you've used manual therapy recently that's helped one of your patients?
Yes, absolutely. One of them, like I gave an example before, of soft tissue mobilization. One that helps a lot of patients who complain of headaches, migraines, is myofascial release to the suboccipital musculature, which is right at the base of the occiput here. Sustained pressure there causes the muscles to relax and kind of decrease the amount of stress and pressure that's put onto the skull, and a lot of patients have found a lot of relief from that technique. Another one is just manual traction, very simple, joint mobilization. When you are focusing on the shoulder or the knee, something simple like distraction or an inferior glide. Many patients have found relief from that and an increased range of motion just by doing that in accordance to the range of motion of the joint and how it's going to slide and glide.
Awesome, very good. So if you want to learn more about manual therapy, there is actually a guide on how to bill and document for manual therapy. It is in box. So I hope you enjoyed our video and have a happy day.
Thank you very
Thanks.
much.
Okay, bye-bye.